Hello, my friends, visionaries, seekers of more. Welcome to Let's Talk. I am Shay Marville. This isn't just a podcast, it's a journey. Do you ever feel that persistent tug, yelling, whispering, crying? There's more for you. There's more in you. Are you ready to dive deep, challenge your beliefs, evolve your perspectives? Together, we'll explore the depths of self-discovery, unlocking talents, passions, and potentials, one conversation at a time. Sometimes I will remind you to unleash your greatness. Sometimes we'll have a guest modeling their greatness. Sometimes we'll meditate. So sit back, open your mind, embark on this journey to unleash what? You. Let's begin. Hello, my friends. Welcome to Let's Talk. On today's episode, I have a very powerful guest, Dr. Patricia. She is a functional medicine doctor, and she's an MD who is focused on detoxing, on gut health, on hormone health, on de-stressing and empowering individuals and communities to be stronger and more powerful. Dr. Patricia, welcome to Let's Talk. I am over the moon to talk to you and to hear what you have to share, because I mean, your stories on your podcast, and I want you to talk about your podcast, please. They're courageous. They really are, in a time when it's hard to tell the truth. So welcome to Let's Talk.
Thank you.
Tell me a little bit about how you went from being an MD to focusing on functional medicine.
Yeah, it was, functional medicine is root cause medicine, and it's the kind of medicine that one would train in after having completed at least family medicine training. So you would go through your medical doctor undergraduate training and then your residency training. And then if you want to be a functional medicine doctor, you have to do an additional, for me, it was 2 years of certification. And it's hard to find the time, the energy, and the motivation to do that when you're already engaged in a very busy practice as a medical doctor. We're basically trying to just survive and avoid burnout as it is. So to add in more training is really tough, and it usually requires. When I speak to functional medicine doctors and for myself, it was usually something that triggered intense motivation, like either the illness of oneself or a loved one. Mm-hmm. And for me, while I had been experiencing problems with my own health, in retrospect, I had lots of signs of issues with hormones and gut health and the stress response and my toxins tolerance. What I now call my 4 pillars of whole body health. It wasn't until my dad got diagnosed with ALS, or amyotrophic lateral sclerosis, or Lou Gehrig's disease, yes. With no family history of it, and it's a fatal disease with no cure, and it just shocked me so completely out of my comfort zone, and my comfort zone at the time was pretty intense. Like, I was practicing as a specialist in physical medicine and rehabilitation. I was conducting research. I had multiple studies already published in my area of expertise at the time.
Yes.
And so, and I knew how to dive into the research, and I had been using those skills to study this one specific area. But when he got sick, I just started to ask the question, why? Like, why would an Iron Man
I was going to say, you were shocked because he was such a physically fit person, right? And he was doing these Ironman events and challenges, really pushing his body to the limit. And there's no history in your family of the disease, right? And I think I heard you say in one of your podcasts that, your genetics are only 5% of what, like in terms of instigating some disease process. So it was shocking that happened to him.
Yeah, it was. And what's interesting is that while at the time it was shocking, now when I look back, there were signs that his
Mm,
health was not great. And I think this is where even people who are very health conscious, like how he was, and myself too, I was very health conscious as my body was telling me that things were not well. Um, there are some signs of early issues. And what I've learned is that when we ignore those signs, when we write them off, or either we've written them off, or maybe a healthcare professional, with all loving kindness, but ignorance, really, unfortunately, about the specific issue, has said, well, that's just aging, or that's
right.
normal, or your blood work is fine, so don't worry, right? The thing is, blood work does not give us the whole picture of what's happening in the chemistry of the tissues.
Hmm.
So, looking back on his health at the time, like now, from what I know now, he had some belly fat. He was fit with belly fat, which is a sign of internal inflammation. He had
Wow.
had heartburn for some time, and he was on medication for that, which causes its own problems. He was a perpetual nighttime snacker, so he would be eating pretty well during the day, but snacking at night, which really throws off your gut health and circadian rhythms, which throws off your hormone balance.
Hmm.
And he was eating what we would call a healthy diet, but now we know is not. So ultra processed soy food, for example, like some people are really trying to be healthy and eat a plant-based diet, and they'll go and buy like ground soy or soy-based meals, and
Yes.
he was eating it every single day. And if you look at the ingredient list of those foods, they're just full of food additives and what we now know harms gut health and causes internal inflammation. And inflammation is like a low burning fire that just, if it keeps being fed, if the root cause of that keeps being done day in, day out. So, the eating at the wrong times, eating the wrong things, even though it's called healthy,
Yes.
over exercising, on medications for things that should be naturally reversed, like heartburn, should not be treated with a medication for longer than 8 weeks. Even the medication itself says that on the prescription like warning
Mhm.
label. Um, so in retrospect, he had lots of reasons to become sick, and the genetics is probably what predisposed him to get ALS versus multiple sclerosis or Parkinson's. That, I think, is the genetic play, is what is your weak link in the chain, and if you do
Right.
have your unique combination of root causes, how is it going to express for you?
Do you think because we're like in this process of, evolving and learning and evolving, but we're doing it in a system that already has a structure, an economic structure, that it's hard to infiltrate this system with new ideas and new approaches because we're so married to a system that has worked for a certain population, but now as we're evolving and as the environment changes and as all these things that that we're learning about stress and about toxins and about how our body actually functions, we're not actually able to adapt quick enough to help people.
I could actually argue the opposite in a way. So, just to play devil's advocate a little
I
bit,
love
is
it.
that, yeah,
Do it, do it, do
and
it.
it gives me hope. This is what gives me hope, is that a lot of the problems that we're seeing these days in terms of the development of these chronic diseases is really in the last 100 years. Before that, it was primarily you would pass away from an injury or an infection or actual lack of food supply, right, from a starvation, famine, or that kind of thing. So, or food poisoning. So these things are those things we've gotten pretty like amazing. Our system is really good. If you are in a car accident or you have a fracture or something, I'm so thankful for the medical system. If you
Me
have an
too.
infection that's life threatening, thank goodness we've had the advances that we've had. Food poisoning, bacterial infections. I had meningitis as a child, and if it wasn't for IV antibiotics, I would not be here today. So I have a deep reverence and respect for what we have accomplished in the past
Yes.
100 years technologically, and yet there's the, it's a double-edged sword because technology has also created things that unknowingly, like, I really don't believe anybody is sitting somewhere saying, ah, ha, ha, we're making all
Agreed.
this money while everybody suffers. Like, I don't believe that to be true most of the time. However, it is true that when certain things were created, like ultra processed food, like certain medications, we were unaware of the consequences that it would have on parts of the system that we didn't even know existed, like our gut microbiome in our gut, and how intricately connected our health is to that community of microorganisms living inside of us. And so, and it used to be that it would take anywhere between 20 to 50 years for what we discover in research to be like applied in medical practice,
Yes.
and there were even times when people were ridiculed and shunned and ostracized for discoveries, right? Like people like Louis Pasteur, and there was a lot of Galileo for his medical discovery, for his
Yes.
scientific discoveries. Nowadays, I find that because of social media, which is also a double-edged sword.
Yes.
However, the positive side of it is that it's much faster now to, especially with people like myself, and there's a lot of people like myself. I am not alone. I am standing on the shoulder of giants and holding hands figuratively with other people who are on the same mission, which is finding out the information that needs to get out to the public, because if we wait for it to get out to the doctors, we're going to be waiting for 20 years, because to change a medical curriculum
Hmm.
is hard, and it requires a lot of vetting, and doctors now are like, very evidence-based, which again is a double-edged sword, right? Like, if you're waiting for all of the studies to be done to prove something concisely, sometimes it's financially not possible to run those studies, but it doesn't mean you should ignore the totality of the evidence.
Right.
um, so sorry, go ahead, you had a
Yeah, no,
question.
and is that why you stepped out? Like basically you've stepped out of the conventional system, right? Of providing medical care, and you've created your own consulting, coaching, training program, right, for your patients. Would you describe it in that way, or would you describe it in a different way?
It's slightly different. I took a big break for a while because it was overwhelming. I had a lot of cognitive dissonance where I'd be seeing patients and I would be speaking to them now with the eyes of functional medicine and seeing how so much of what they were experiencing was lifestyle and nutrition. And yet the people that I was seeing, they weren't necessarily coming to see me for that. They were coming for the prescription and for the, medication or whatnot, the referral for surgery and that kind of thing. And while that is absolutely necessary still, and thankfully my colleagues who I was practicing with, they're excellent and they can continue that work. I found that for myself, it was no longer satisfying. So I took a break, reevaluated, and my first step was to provide health promotion programs for women, because my experience with my dad was that for him, it was too late. It was too
Yes.
far along, and he
Yes.
was not ready to make the heroic changes that would be necessary in his lifestyle. And I recognize that it's much more effective to catch people when they are in those early stages, when the body is saying something, but we're not yet deeply entrenched in the medical condition. While it's still possible to reverse it at that time, it does take a lot more effort. So I started with that, and more recently, I've started a functional medicine clinic covered by health insurance, in British
Yes.
Columbia, which is kind of like a blend of everything I've learned through the experience of the health promotion, as well as my training as a functional medicine doctor. So now I can offer that to my local community as well. So yeah, I feel like I still have my foot in the conventional medical care system, which is wonderful. And I have it in the other, and I don't even know what the other is. It is more holistic.
Yes.
It is group based. When it comes to nutrition lifestyle, my medical program is a group medical program. because I
What is
find
that?
that,
What does
yeah.
that mean? Sorry, what does that mean, a group medical program?
Yeah, that means that we basically go through the treatment protocol as a group. So we
Oh,
have, the initial visit is like a screening visit. It's a consultation, and it's a consultation is one-on-one, and it's to determine if the person has, a condition that needs to be treated that is amenable to the treatment being provided. And
right.
in this case, my treatment is treatment for inflammation,
Okay.
because we've discovered that what everybody is on board with is that inflammation is a root cause for almost every single chronic disease, including hormone imbalances, gut disorders, cancer, even things like PCOS, osteoporosis, endometriosis, low testosterone. They can all be linked to in unhealthy inflammation, and there are treatment protocols aimed at addressing that. So I'll screen a person one-on-one, but then after that, we do every session, every medical visit is in a group setting.
Well, okay. That's wild. So this is I've never heard of this. In Canada, like and is it strangers who come together and they're in a group? They're there for the same reason. So let's say you have colitis, or you have Crohn's, or you have celiac, or anything. You've made an agreement that part of your care is as a group.
That's correct. Yeah. And even depression has
Wow.
inflammation as its root cause. And
Yes.
there's research showing that a Mediterranean diet decreases inflammation, which decreases depression, like the diagnosis. Um, so it's really powerful because of these advances in research and the fact that we're able to access it online, like access the results, we can then offer it as an evidence-based treatment protocol. And rather than me offering it like to one person at a time and then having them do the lifestyle and nutrition and all those things, supplements to decrease inflammation naturally, naturally with supplements, right? Not with
Yes.
prescription medications. What I find is that when you do it together, not only can you help more people at once, and we do know that the medical system here is so overburdened that the more efficient we can get with it, that's great. But actually, the outcomes are better. People are more likely to engage in lifestyle changes and nutritional changes when they are a part of a group, because the sum is greater than like its parts.
This is so fascinating though, because uh I've grown up here in Ontario, in Toronto, and y- as I what I've observed is that, number one, I'm grateful for the healthcare that we have. And if you have an acute problem, this healthcare is particularly, great. Um, and my caveat is that I come from a healthcare family, lots of nurses and doctors and practitioners. However, what I've observed is over the years, over the decades, is that doctors seem to have less and less time and seem more and more stressed. And I sometimes feel stressed when I go to the doctor because the doctor is rushing. And I sometimes I take a little time to warm up. Like I try to make notes before I go so that I remember. But it feels more fragmented. And what you're talking about is it feels communal. It feels like a collective of people that you're you're sitting listening to, and then you're getting more time. Maybe you're getting more time with the physician because there is a group of you. Like, this is extraordinary.
Oh, yeah. I mean, you get so much more time and you develop a patient-doctor relationship that is more healthy and balanced because it is in the context of other people being part of the relationship. So it's less likely that you're going to run into like friction, with your healthcare provider, because it's when you're in a group setting, especially when you know how to lead a group,
Yes.
and that's where my health promotion program experience really was really helpful. Um, you end up like the strengths and the stretches that we all have, right? We all have areas of strengths and areas of stretches. When we are part of a group and everybody has different strengths and different stretches, it's like we can hold each other up. and we
Mm.
inspire each other. And as a leader, you create an environment of inspiration, not comparison or envy, but rather motivation generating.
Yes.
And when one person is sitting in the back row, so to speak, right? Access is all telehealth. Someone's sitting there and they're not participating, and they might be thinking to themselves like, "Oh, this is too hard, and this is ridiculous, whatever." And then they hear someone else say, "Oh my goodness, I did that thing that you told us to do, that part of the treatment protocol, and I am feeling 1,000 times better. Like my gut, my bowel movements, my energy, my sleep." I notice the person who's sitting in the back kind of perking up and paying attention, and then the next visit they say, "You know what, I did the thing and you're right, it really makes a difference." And there's nothing I could have said as the
Right.
person delivering the treatment protocol that would have motivated them to do it, because some people have personality things where they don't want to hear from an authority figure. They all actually kind of reject it almost. But when
Yes.
they hear from a peer,
Yeah.
and that's where I think that's why, like, Weight Watchers, when it originally started, or Alcoholics Anonymous,
I was
a
thinking
lot of the
that.
power of those groups was in the collective, as you say.
Yeah. Well, I also wonder though about the people who are concerned about privacy. Are they signing anything that says, what's discussed in this group will not be discussed anywhere else? Or is it just assumed? Like, how does that work?
Yeah, so in the visit, we go through what are called our rules for conduct in a group medical visit. So we go through the rules for privacy and respect and all those kinds of things. It's agreed that no one is sharing any information, or they don't need to speak up if they don't feel like they want to.
Yes.
However, part of the screening part of the program, of course, the one-on-one is, this is a group medical program, and so are you going to join or not? And that's okay if you don't, but this is how it's delivered, and so you either have to be okay with it or not. And then we do go through the rules on the first visit, and the rules are provided in writing. No one needs to sign it, but there's a like a verbal agreement, consent to that process.
And is there a cost like that's separate from your OHIP or?
No, it's all covered by MSP. And I have to say that it's because of the work of certain doctors, like Dr. Ron Remick, who's the medical director of the Mood Disorders Association of BC. Him and other people have sort of championed and been successful in getting billing codes for group medical program visits. So long as it's delivering an evidence-based treatment protocol for the condition, that you're assessing,
Yes.
then you can charge MSP or OHIP for that service.
I'm sorry. I like my mouth. I'm picking it up off the ground because it feels, this feels very evolved. And, one of the things that I'm hearing a lot about right now in my coaching program and working with different individuals is a lot of women are struggling with perimenopause and menopause and struggling with their own identity, struggling with feeling really vulnerable and not having a healthcare provider who can partner with them and help them understand what's going on. Like I remember when I started my perimenopause journey, a few like in the middle of the pandemic, I called a doctor. I'll just say that. And, because we weren't allowed to see each other, in person. So we were doing it on the phone. And this doctor that I respect very much, when I started to say, I think I'm going through perimenopause, like I'm noticing all these things. I don't think it's stress and the alone. I think it's hormonal. What are the steps that I should take? And the first response was, "Oh God, it really sucks to be a woman." And that was a woman, right? And so I said, because I know this person, I've known this person for a long time. I said, please do not ever say that to anyone else because it's extraordinary to be a woman. I just want to be, I want to be educated and informed, and I feel like there's this invisibility to what so many women are going through as they go through these different changes, even to themselves. And then I think it's very hard to talk to a practitioner who thinks, well, it's just what you're going to go through. Like there's nothing you can do about it. You just have to go through it. And then you see this flood of information in social media, which is, take hormones, take these drugs, do this, do that. And I think a lot of people are just like a lot of empowered women, empowered by three different generations of feminism, right? Working, educated, etc., are shocked by what's happening to their bodies, and they're looking for help and support, and they want to be empowered, with information. Like, how do you approach, this subject matter of perimenopause and women going through a process of transformation?
Yeah, so first, what I have to say is that our medical training really doesn't cover it nearly enough or in the depth that it deserves. I think it's like 5 hours of training in menopause, and it's not really a holistic training. It's more like, these hormones start to drop and this hormone starts to not be made anymore. And then when you reach this certain level on your blood test, and you haven't had your period for 12 months, now you can be called in menopause. And then there was, some discussion around hormone therapy prescriptions. And then the Women's Health Initiative study came out in the early 2000s with very concerning results that were misinterpreted at the time. One of the primary investigators has gone on record to say that she's very sorry for the way that the results were interpreted because it resulted in people being afraid of hormone therapy prescription. And now,
Yes, yes.
fortunately, she's speaking up. Dr. Joanne Manson and other practitioners and other researchers are reevaluating the data and showing that there actually isn't a risk of dying of breast cancer from hormone therapy. There are other risks, and the reality is that it's not the only solution. When you are going through perimenopause and you're going into menopause and then you're in menopause, what really dictates how well you do through those phases is how you're supporting your body before, during, and after. And that always comes down to nutrition and lifestyle, period. Right. And again, like I always, when it starts to get overwhelming to think about like all the things we need to talk about there, I think about my 4 pillars of whole body health, which is, are you supporting your hormone balance through nutrition and lifestyle? Are you supporting your gut health, your stress response, your toxins tolerance? And the reality is that these days, unless you're extremely intentional and you're well informed, you are not, because if you're living the way that that most people are living, even if you're doing all the things that we're told to do from a health perspective, you're not actually supporting those 4 pillars of health. And as they deteriorate, and for each person, it's like a unique combination, right,
Yes.
between those 4 things. It will affect your hormone balance and your hormone health, and that will translate into having a worse perimenopause experience, a worse menopause experience, right? And so the other thing I have to mention is that going to your general health practitioner, your family doctor, and asking them for support with your perimenopause and menopause, it's like going to your accountant and ask them to help you with marketing. They simply do not have the training for it, and it's not their fault. Just like an accountant is not trained in marketing. Yes, a marketing person needs to know some accounting, but they're not going to be the accountant, and the accountant will not be your marketing. You need to have different people on your healthcare team to provide you with support, and you need to know what you should be asking your family doctor for help with or not. Because if you don't, if you assume that your family doctor, or maybe even the endocrinologist or gynecologist, has been taught enough about nutrition and lifestyle to guide you in that, you are making the incorrect assumption probably 99% of the time, unless that health professional has gone on to do additional training, such as functional medicine or holistic nutrition and those kinds of things, because it's its own category. We got 4 hours of nutrition training in medical school,
But I
and
think
yeah.
most people would not, like what you just said, that is like, that is mind blowing, because most people would not know that their doctors do not know about the health experience or process that they would assume that that doctor knows about it. And if that doctor doesn't know a lot about it, that they would then refer you to someone who does know. And I think what I hear, certainly, and of course this is anecdotal, what I hear is that people are just, pushed off, or, dismissed, or told, I did the panels and your hormones are fine. Like, you're just, everything's going, don't worry about it. And so I think there's a lot of fear to begin with. And then when you're told not to worry about it, and your physician is saying, it's no big deal, or, this is just what you have to go through, I think your symptoms even become invisible to yourself. But you just mentioned gynecologists. Are you saying gynecologists are not in their training? They are not trained on perimenopause and menopause? That doesn't seem
Not
like
in the
that would
way
make
that,
sense.
not in the way that you're speaking about supporting it. So if you're speaking about, what kind of nutrition is required for healthy hormone balance,
Yes.
what kind of lifestyle will support your circadian rhythms, which dictate your melatonin hormone, your cortisol hormone, which then influence your insulin, and so on and so forth. No, we're not trained in that. And I did gynecology as part of my residency training. They are trained in a lot of things. They are trained in the anatomy, very detailed anatomy. They are trained in basic hormone sciences. Many of them are not prescribing hormone replacement therapy because they're not trained in hormone replacement therapy and they don't feel comfortable with it.
Yes.
They are trained in surgical procedures, which requires a lot of time and effort and training, right? Like if you have ovarian cancer, or if you have a tumor, or if you need a hysterectomy, they have every single capacity and ability, and it is profound. However, it is not within their training to be able to sit down with you. Not only is it not within their training, but it is not supported by our current structure of the medical system. So in my program, for me to resolve issues that affect hormone problems in perimenopause and menopause, it takes 8 sessions, an hour and a half each session. Our medical system is not designed for a doctor to be able to reasonably spend time with you in that, and not only that, like expect financial compensation for that effort. And again, if you're not doing that in a group setting, you find yourself repeating the same thing over and over. And that's what I was finding myself doing, is like I was saying the same thing over and over, and it's
Yes.
exhausting.
Of
So,
course.
so while there is information out there about menopause and perimenopause and what needs to be done to support it, the system is not set up, first of all, in the training of the gynecologist to provide that kind of information, and it's not set up for the gynecologist to have the time to provide that
Hmm.
information.
What 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 do you think in 2023? What do you think a woman should do, that's over 38, right? To start, like, being proactively engaged in, looking after their body. Like, maybe talk to us about that piece and the four pillars.
Yeah. So there's so many different ways I can approach this. One thing I will say is that you have to have a little bit of a beginner's mind, because what I find is a lot of women are deeply entrenched in what they think is healthy, and they're not willing to let go of their habits. And what's really harming us is our daily habits, and it can be really hard to break. For example, I'm going to give you one example.
Tell me.
Breakfast, breakfast, break
Breakfast.
how you break your fast, right? So eating is about when you eat, because eating the right food at the wrong time is the wrong food, no matter how healthy it is, right? And what you eat when you do sit down to eat, if that's it, and how you eat it is so influential for your hormone and your gut health, which then affects your your premenopause, peri, and menopausal experience. So just as an example, um, when I tell women what they should be eating based on research, based on scientific evidence for breakfast, the level of resistance that I encounter is profound. And I get it because I used to eat a certain way for breakfast, thinking it was very healthy.
Yes.
And it took me really coming across lots of different research and just being like, okay, fine, I will accept this and I will change my breakfast. And what a healthy breakfast looks like is, and part of the problem too is that a lot of things on social media are correct and a lot are incorrect. So fasting, let's start with when to eat your breakfast. So fasting is very popular right now in the concept of narrowing your eating window, like how much of time you spend eating in your day and how that allows you to clean out the garbage of your body, so to speak, when you're not eating. And that is completely correct. And if you do practice some types of fasting, you will actually lose weight faster and find it easier to maintain your weight. But if you ignore the hormone effects of fasting at the wrong time, over time you're going to run into hormone imbalances from your fastings. For example, and this is actually research done in women, which is great because most of the research in fasting is done on men.
Yes, I know. I know. This is
So
one of the traumas we're going through right now.
yes, exactly. So yes, not restricting your eating window, the time you start eating and the time you stop eating, including drinking caloric things, to a maximum of 12 hours. So let's say you start eating at 8 o'clock in the morning, you should finish by 8 o'clock at night. Like you should not be eating anything after that. If you want to have a 10-hour fasting window, you narrow that down by 10 hours. So 8 a.m. to 6 p.m. Okay.
Yes.
For women, you have to break your fast before 10 o'clock in the morning.
Why?
And I see a lot of women breaking their fast at like noon because they've been told to skip breakfast and eat their first meal at lunchtime. And while initially you might feel energized and lose weight, what the research shows is that over time that creates a stress response in the body where the stress hormone cortisol goes up. So that's the stress response pillar. And the cortisol causes inflammation. And one of the signs of that is actually this group of women that was studied, they got high blood pressure, hypertension.
Wow. Because they were stressing the body, the cortisol stress hormone was being elevated. And so it was giving them a hypertension.
That's correct. Over time, not right away.
Over time.
This took time to develop. So, but if you take that same fasting window, like let's say you commit to 10-hour fasting window, like eating window, and you move it earlier. So instead of eating between 12 and 8, which is what a lot of women were doing, you eat between 10 and 6. So just shifting that eating window earlier to make sure that you eat breakfast no later than 10 o'clock in the morning. That alone can be very beneficial for your hormone health over the long term.
And what would you suggest is a good breakfast?
Yes, so this is the point of resistance. So I am of the camp, based on science, that carbohydrates are healthy for us. So having some oats for breakfast or a sourdough bread, so a good quality bread with no weird food additives or preservatives, can be very helpful. However, on its own, it's not good for your blood sugar balance. So you spike your blood sugar too high, which causes your insulin hormone to go too high, which then imbalances your other hormones like estrogen, testosterone, cortisol, progesterone. Okay.
Right.
So in order to eat that healthy carbohydrate, you have to pair it with vegetables, cooked preferably, because as we age, we have more and more issues with digestion, and we need the cooking to pre-digest our vegetables for us.
Interesting.
Plus protein. You need to have enough protein. And there actually are some very specific amounts of vegetables and protein that you need to hit through the day. So for vegetables, you're trying to get it between 6 to 8 or 9 servings of vegetables a day. And that's before it's cooked. So it sounds like a lot, but what it means usually is you're sitting down to a plate and you're looking at your plate, and half of your plate is vegetables.
Yes.
And you're seasoning it with your own olive oil, vinegar, and salt. The vinegar helps with the blood sugar balance too. Okay.
Oh.
Then the carbohydrate is about a palm-sized serving,
Hmm.
and the protein can also be a palm-sized serving. So if you want to get
Oh.
really detailed, you should be eating between 20 to 30 grams of protein with each meal as a woman.
Yes,
Okay.
yes.
And plus the vegetables, and then the healthy carbs. And actually, the sequence matters. If you eat your vegetables and protein first, and then you have your slice of sourdough bread or your little cup of oats. The problem is when women are having these like bowls of oats with bananas and nut butters and berries and honey.
Yes.
It's a sweet breakfast. It's not a savory breakfast. Nut butter has almost no protein in it. It's mostly fat and fiber, which is healthy, but it's not a protein source.
Right, right.
And if you eat that every day for breakfast, you're going to over time. And the thing is that what worked for you when you were younger doesn't necessarily work for you as you age, right? Yeah, exactly. It's the
100,
elixir of youth. It runs out.
100%. And again, I'm a pretty open person. During the pandemic, so many things happened. And the first 2 years, I gained a lot of weight.
Mm.
I wasn't going to the gym. I was under a tremendous amount of stress and, entering perimenopause. And so again, I went to the doctor and I said, I've gained all this weight. And then the doctor weighed me. And then I asked the doctor to weigh me 3 more times because I could not accept the number. And the doctor was like, maybe something else is wrong with you because I don't think we need to do this again. And and then I said, okay, I think I need a nutritionist. And the doctor said, well, just eat one meal a day.
Oh
And
my goodness, that's the
and and
worst advice you could give a
and
woman.
exactly, and go on a Middle East and go on a Mediterranean diet.
Mm.
And so obviously I'm a researcher. I started my career as a researcher. So I went hard into research. I made a mistake, a crucial mistake though, in the beginning. I started to exercise really hard. I started to do
Mm.
lots of cardio and my weight started to go up. And
Mm-hmm.
I felt agitated. So then I did more research. And then what I started to do was I started to do less cardio and I started to do more weightlifting. And then
Yes.
I started to have, smaller meals and do some fasting. And now this isn't an Ozempic story. In 12 months, I know it's not, I know that's a long time, but I lost all the weight that I
Mm.
gained. It did not go back to where it was in the beginning, but I did lose it and I felt so much better. And so now I don't believe in dieting for myself. I'm just trying to look after the container, the body that looks after my soul is the way I look at
Mm.
it. And but it's consistent research. And that's why I'm so excited about the work that you're doing, because I think so many of us are being misled. And now it seems like there's this push to use drugs to lose weight rather than using your body and listening to your body to actually, manage your weight, like looking at weight as information rather
Mm-hmm.
than looking at it as, you're bad or you're not, like in a judgmental way. Like I knew I had to lose weight because my blood pressure for the first time in my life was going up, because I was not feeling well, because I was having digestive problems. And of course, I could not afford to buy a whole new wardrobe. I could not fit into a darn thing.
Mm.
And so, so for me, I knew that I had to lose weight for various reasons. I think many of us are going through that.
Oh, I know. And my heart goes out to people because it's easy for me to sit here with the information I have in my brain and you know, I'm at a point right now where I can honestly say I do know what is needed to support whole body health. And when I work with people or when I give information on, I'm on social media for that reason because it allows me to sleep at night knowing that I'm sharing. I'm not just like holding on to this information for myself and my patients and my clients. I do share the information on various social media platforms. It is hard, though, to share the information that needs to be shared in those mediums, right? So I
Yes.
do longer YouTube live videos. And however, I do find that when women work with me in my programs or in my clinic, it's a different experience because it's more sequential. It
Yes.
builds on the previous information, and so it's not disjointed. So I think that sometimes women simply need to find someone that they want to work with, that they do some homework and look up, like, what are the recommendations? Are they in alignment? Do they promote me nourishing my body? Do they recognize the role of the stress response? Like, you're right, people who don't eat enough and overexercise, they are depleting themselves and driving themselves into high cortisol states, which produce inflammation. So you can have people like yourself over-exercising and undernourishing and gaining weight, particularly around the belly. And
Yes.
so when you hear, what I would recommend is that when you're going to decide if you're going to work with someone or not, get a sense for, based on what they've published or posted or spoken about in the past, or what they talk about on their website. Is it an alignment? And then it's worth oftentimes to making a commitment. So while I'm very grateful that I can provide this medical service for people with medical conditions and diagnoses in my province, I
Yes.
have to use health promotion programs to help women that are not in my jurisdiction, right? I'm a medical doctor. I can't treat people outside of out of British Columbia.
Yes.
And I also can't charge MSP, our public health insurance, when they don't have a medical condition and I'm not offering like a specific treatment for it, right? So that's where the health promotion side comes in, and that's not covered by healthcare. And the biggest barrier that I find in Canada, it's less so in the US because people there are a little bit more used to paying out of pocket for health,
Yes.
and what they need. But Canadians have this feeling that everything they need should be provided by the public healthcare system. And if they have to pay for anything, they really don't want to, and they're very resistant to it. And what I have to say is that resistance in and of itself can be very harmful to your health, because the
Yes.
reality is that a lot of the information you need for basic health promotion is not covered by the public health insurance, and you do have to invest in yourself sometimes.
100%. Can you tell me, how do you support yourself? And I'm asking from 2 points of view. One, as an individual who's caring and growing, and one as a professional who, how do you surround yourself with other practitioners who have the same interest?
Yeah, it's such a great question. So first of all, I support myself as an individual, and I'm a mother of two young children. My husband has his own company, and he's very busy. So I'm a very big caregiver in our family, and I'm in a small community now where there's no after school care. So I'm on, I
Mm.
guess, 3 o'clock onwards. Um, and what I had to do is I had to be very intentional with creating a routine that I would just follow. As long as I've followed the routine and everybody in my family is aware of it and supports me in my routine, I can
Yes.
maintain my health, right? So what that looks like, for example, is my alarm goes off around 6 o'clock in the morning. My husband is with the children, making their breakfast and getting them ready. And I use the morning very intentionally. I do my meditation. So one thing I didn't used to do was I wouldn't offset the positive stress with healthy rejuvenation practices. So, exercising is a positive stress, like going for a hike outside is a positive stress. Um, Doing the work I love now, right, is a positive stress. And I have to counterbalance that with meditation and breath work and just
Yes.
gentle walking in nature, right? So I have to be very intentional with that. So my mornings are designed to either counterbalance my positive stress, or I use it for weight training. And I agree. I think weight training 2 to 3 times a week is a non-negotiable for human beings, especially as we age. Like after the age of 30, it's like it shouldn't be an option. You need to do it. If you don't strength train, you lose 50% of your strength by the age of 70.
It was
I
a
mean,
it
it's
was a game
profound.
changer. It's a game changer.
Right, it's such
Game
a game
changer.
changer. And
Yeah.
so many of us are doing chronic cardio, like my poor dad, he was just like a chronic cardio man. But anyways,
Yes.
that causes inflammation.
Yes.
So my morning routine, I just kind of get up and I do it. And then I have to get my breakfast right. So eating that breakfast I told you about before 10 o'clock, like I
Yep.
have to get that right. And then I have to get my evening right. And what that means is that I don't eat after 8 o'clock p.m., period. Like nothing can
Mm.
go past my mouth that requires any kind of digestion, whether it's drinking or eating.
Wow.
So I have to get it all in before that point in time. And after 8 o'clock in the wintertime, obviously the summertime, the sun sets later, but in the wintertime, I don't have any blue light exposure. I wear blue blocking glasses if I have to. I have a red light filter on my phone, so I don't look at blue light. I don't open the
Yes.
fridge door without my blue blocking glasses on. And I get to bed by 10:30, the latest.
Wow.
And except for Fridays and Saturdays if we have a social
Yes.
event, right?
Sure, sure.
And so I find that, and then through the day, and my dinner is the same as my breakfast in the sense of the proportions, but I'll have
Mhm.
rice instead of sourdough bread, for example, right? Or like a nice pasta instead, but I'll always have vegetables and protein. And in between the morning and the evening, which are kind of like my foundational posts in the ground, as long as I have those two firmly anchored, what happens in the middle isn't as important, but I have to pay attention to my stress levels through the day. And if I'm
Yes.
finding that my stress levels are going up, and I notice it for me, and you should just become aware of it for yourself, because I used to not be aware of it. I disconnected my mind from my body when I was younger to deal
Hmm.
with the stress, which is not a good coping mechanism, by the way. I notice that it's in my neck. I start to get tension in my neck and tension in my upper back and in my jaw. For other women, it's other things, but for me,
Yes.
that's my tell.
Yep.
And my breath starts to get shallow and kind of fast versus
Mm.
deep and easy and slow. And if I notice that I'm starting to get more into a stress response, about half an hour before I go to pick up my kids, I stop what I'm doing and I do stretching or meditation or breath work. Like I have to intentionally bring my stress down and do deep relaxation
Yes.
for my
Yes.
body.
Yes.
Otherwise, what happens is I go pick up my kids in this state of like nervous excitement and energy,
Yeah.
and I just can't relax from that. And it influences how I interact with them. I'm more short tempered with them, more irritable, and with my husband. So it's not just for me, like everything I'm doing is not just for me, it's for the health of my relationship with my family.
190%. I
Mhm.
know for me, meant like I'm telling you, practically all of the symptoms I was having or signals I was having around perimenopause disappeared when I became very intentional
Mhm.
about my movement, about what I was eating, about my sleep. And it was non negotiable. And it's hard to do that because I think society says, do this, do that, do that, do this for everyone, look after this person. And you're being pulled a lot away from yourself, and away from looking after yourself. And I feel like maybe one of the gifts of going through the process of change is that you start to give birth to yourself
Mhm.
intentionally. You have to make a choice about really loving and caring for yourself. And I think that changes how you treat your partner, how you treat the kids. Like I've heard people in my family say recently, Shay is much nicer.
Yeah.
But I have a tough question for you. And you didn't answer the question about your circle actually. Like do you have people around you that have, or in the same practice or and have similar beliefs supporting you? Is
Yeah,
that a tough
so
one?
it was something was hard. I had to let go of my group of colleagues in my physical medicine and rehab, but there are still some I'm in touch with. Um,
Yes.
but it was definitely like a difficult thing. It was part of my family, like my colleagues, and then I was very fortunate to connect with primarily naturopaths and now more functional medicine doctors who I've met through my training, and we keep in
Mm.
touch through social media. Like, for me, Instagram is about going on and saying hi and supporting them with whatever they're doing and leaving positive comments on their on their pages and things like that. So it's a very positive experience. And then it's nice because I do feel like when something comes up, I can reach out. Like I have a WhatsApp group of functional medicine doctors, and if something comes up, we'll kind of message each other and for support and understanding and all those sorts of things. So, and also now that I'm working my clinical work is through the Mood Disorders Association of British Columbia, which is a clinic of physicians, and they're all, very in tune with, this is for mood disorders, but I also, in my practice, I also take physical disorders for treatment.
Right. Right.
Um, so it's really nice to be a part of a group of convention, like traditional medical doctors too, again. So now I'm feeling like I'm part of a really beautiful community and meeting wonderful people like yourself through that community. I have to say I'm in a very good place right now.
Yes. Yeah. It feels that way, and I'm so excited about the work that you're doing, and knowing you, and seeing the community grow. How, for people who are going through a disease process, let's say, they've got a diagnosis of some sort, and I know you've referred to your dad, and his, what he went through, and how hard it was because it was too far gone. For people who are at the beginning of a process, who want to feel like, even though they might feel out of control in one way, there's something for them to do. Can you recommend a way of thinking, or how they should be, asking questions about how to help themselves, so that they feel empowered even as they go through this experience of suffering or
Yeah, for
helplessness?
sure. I think that some of the key ingredients is that you have to surround yourself with a positive, like-minded community as best as you can. Okay.
Hmm.
And that'll look different for different people. For some people, it is like, some people with Parkinson's, for example, will feel very well supported in a group of people experiencing the same thing, whereas others will feel worse, actually. So you have to kind of suss out for yourself, where is that community, and surround yourself with that community and be in it. Um, and you have to develop a thirst for knowledge and just keep looking up and learning and listening. And there's a lot of resources out there now with podcasts and, YouTube videos and that kind of thing. What I really recommend to people is that we get caught up sometimes in labels.
Yes.
So I'm labeled as someone with multiple sclerosis. I'm labeled as someone with celiac. I'm labeled as someone with ALS or Parkinson's. Okay.
Hmm.
And while there are definitely some unique pathways and aspects to that condition, at the foundation of it all is the pillars of whole body health. And part of your research should not just be to look up things related to Parkinson's or related to osteoporosis or whatever. Part of it is like, what is necessary to support the health of a human body, right? And
Hmm.
that's the kind of research that should be done, because when I was focusing on ALS, I couldn't get anywhere. It was very frustrating because there hasn't been a lot of research done specifically in these, in these very small kind of micro niches of things. But when you start getting into the research of like how the body works, how the human body works, like the
Yes.
hormones as the messaging system, the foundational aspect of gut health, like Hippocrates was right, disease begins in the gut. And what the research does point to is that no matter what label you have, there's always a component of gut health involved. So if you're in doubt and you just don't know where to start, as counterintuitive as it may seem, like it might seem counterintuitive with someone with PCOS or endometriosis or osteoporosis to be thinking about gut health. And yet that's exactly what you need to do. You need to start
Yeah.
with your gut health, get that dialed in, like really understand the nutrition that works for you, that supports it, what is needed to restore your gut health, to get your liver working well again, your gallbladder, if you still have it, working well again, what supplements do you need if you don't have a gallbladder, like just
Yes.
really get super nitty gritty on that. And
Yes.
once you have that figured out, then see what's left over and then work on that next piece, right?
Yes. So, and
So
rather than
when in
focus on
doubt.
the label, and then,
Mhm.
what happens? People focus on the label, and then they Google everything, and they see the worst scenarios. But there's what makes a healthy body work. And then there's also studying yourself, right? Like what helps you, like what's working for me, and then applying that. That helps
Mhm.
to empower a person.
Yeah, like I'll have people and they'll come to me and they'll be like, okay, so I've got this condition. Should I take these supplements? Right. And I'm like, okay, before I tell you to take these supplements, what are you eating?
Hmm.
And they'll be like, oh, I eat really healthy. I have my protein powder and I have my protein bars and I eat whatever, my skinny pop chips and it's like, when in doubt, just get rid of every single ultra processed food.
Yes.
Period. No
Yeah.
matter how amazing the label is, gluten free, if it's dairy free, dairy free products, wow, they are so
Yeah.
crappy. I mean, really, and
Yes.
gluten free
Yes.
too. So many simple sugars there just to make it tasty.
Wow.
You
Wow.
just have to get to the basics. And then, yes, you can layer on supplements, and supplements will catalyze and speed up the recovery.
Yep.
But if you just do supplement work for that specific condition, like I'll get women with endometriosis and they're like, okay, so I'm taking the endometriosis supplements. This should work, right? And I was like, have you addressed the root causes of endometriosis? So
Mhm.
you have to get at the root causes. Otherwise, it's like a fire and you're putting water on the fire with the supplements. And while you're taking the supplements, the fire doesn't burn as hotly and doesn't do as much damage. But as soon as you stop the supplements, it's going to come right back,
Still burning,
still
right?
burning, and
Yeah.
it's still doing some level of damage, even with that water. So for me, supplements are part of it. They're like an add-on therapy. They are not a standalone. And some people think that's how they treat supplements, for example.
Yes. Yeah. Listen, I could talk to you all day. I feel like I'd like to have, I'm already, I want to have you back and I want to talk just deeply about gut health because I think, this relationship between the brain and the gut is profound and we need to talk about it. I want to talk more about women. Like I have a list. I'm going to send you a list of things I want to talk about. But give us the four pillars again. Just give us the four pillars that you focus on again. Tell us about your podcast so people can go to it. But I'm just immensely grateful for your time.
Oh, well, thank you for having me here. This is how we are parts of the agent for change, right? Like that's
Yes.
how we are influencing this situation positively. So I thank you for having me here. Um, and just so that I don't forget to mention this, speaking of community, because I recognize the power of community, I do have a private free Facebook group for women, or people who identify as women, they can join. And it's called Wild Wisdom for Women with Dr. Patricia Mills. And I created that for a safe space that women can show up. And that's where I do provide information about root causes and things that people can do about it. And it's also just a like-minded community of very kind and compassionate women. So I like to go in there and feel supported there myself. Um,
Yes.
and in terms of like what the four pillars are, and there's some detail to it, but generally speaking, the four pillars are gut health,
Mm-hmm.
hormone balance,
Mm.
stress response, and toxins tolerance. And what people have to understand is that they are all interconnected. When one is affected, it has a domino effect on the others, right?
Yes.
And there's positive stress and negative stress. There's the toxins tolerance is like, where's your tipping point, right? Some people can tolerate a lot of toxic things in their life, toxic people and physical things, and other people don't have the genetics for it almost at all, you know?
Wow.
And your gut makes hormones, and that affects hormone balance. And what you eat affects your gut health, which, so it's all interconnected. But those are the way I like to, when I have
Your gut,
structured
your
conversations.
your gut makes hormones.
Yeah, yeah.
Your brain makes hormones and your gut makes hormones.
There are so many tissues, and your muscles make hormones. That's one of the reasons why strength training is so powerful. Yeah, it's not just you have, and actually, your gut is one of the biggest hormone producing glands, endocrine glands in your body.
Wow.
Yeah,
Wow. And
yeah.
it's so funny with weightlifting or strength building. A lot of women have been told you're going to get bulky. And so that's why they don't do it. And it takes a lot to become bulky. It doesn't make you bulky. It grows hormones.
Yeah. And muscle loves to eat sugar. So it gives you so much space with what you're eating in terms of having those healthy carbohydrates. It basically
Yes.
allows you to have those healthy carbohydrates, which are very good for hormone health, especially women's hormones, without overdoing it. And the muscles kind of create that buffer for that.
Yes. Wow.
Mhm.
Listen, oh my goodness. I'm so excited. I was excited when I first when I got onto the show with you, but now after talking to you, I'm just over the moon and I'm just again, thank you so much. I think the time is now. I think there's so many people, humans who need to hear this information. And there's so many women, there's so many of us who have been struggling and are struggling, and we need guidance and we need a community to do it with. And so thank you. I can't wait to have you back on. And I'll share your podcast, your Facebook page, and I just wish you continued success.
Thank you, Shay. And I have a free ebook that I can also share with your audience on how to naturally rebalance hormones. And it's got some of my best tips in there.
Yes. And the answer is yes.
You won't say no.
Oh my goodness.
And so we wrap up another episode of Let's Talk. Remember, my friends, visionaries, seekers, self-discovery is your birthright. Each day, another step on this journey. Don't wait for the world to see the greatness in you. Recognize it in yourself. Embrace it and share it. And if today's conversation resonated with you and you're yearning for more, I invite you to explore The Marvel Way, a roadmap to personal growth at www.coachshaymarville.com and at www.shaymarvillelet'stalk.com and at Shay Marville at Instagram. Listen, I'll find you, you find me. We inspire, uplift, and unleash our potential together. And until next time, stay curious, stay inspired, and keep unleashing the truth of who you are. Bye for now.